After more than 3 decades spent inside operating theaters and rehabilitation units, one truth has become impossible for me to ignore. The earliest decline in strength among older adults rarely begins during movement. In most cases, it starts before they ever put their feet on the floor. I have treated countless individuals who remained active and independent for years, only to suddenly experience instability, stiffness, and unexplained weakness. When we trace the problem backward, the cause was almost never age itself. It was the way their bodies were being prepared each morning. Many of these patients told me the same thing. "Doctor, I stretch every day." And stretching does help, but there is something far more important that most people are never told. Stretching lengthens muscles and connective tissue, but it does not switch them on. Activation is different. Activation wakes muscles up so they can stabilize joints, support healthy circulation, and allow the nervous system to coordinate movement. Without proper activation, those first steps of the day are taken with cold muscles, delayed responses, and reduced joint support. That is when balance issues and injury risk quietly begin to rise. In clinical settings and mobility recovery programs, we observed a clear pattern. Seniors who performed targeted activation movements before standing showed noticeably better coordination and faster lower limb response times than those who relied on stretching alone. These are not strenuous workouts. They are controlled movements done in bed, designed to safely load the system, increase blood flow, and reestablish communication between the brain and muscles before the body bears weight. During reviews of functional mobility outcomes, one movement repeatedly stood out. It consistently produced stronger lower body engagement and more reliable stability responses than the others. That movement holds the #1 position in today's ranking, and the reason may surprise you. In this video, I will break down and rank 5 bed-based exercises from least impactful to most effective. Stay with me because #2 in particular can significantly influence how steady you feel when you stand each morning. Before we begin, let me ask you something. How old are you today, and which country are you watching from? I read the comments regularly and truly value hearing about your experiences. Now, without further delay, let's start with #5. A movement many people underestimate, yet one that plays an important role in preparing the body for the first step of the day. #5. Ankle pumps and ankle circles. At first glance, this exercise can seem almost too simple to matter, but that assumption would be a mistake. Ankle pumps and circles are routinely prescribed by orthopedic surgeons to every patient recovering from hip or knee replacement surgery, and there is a very specific medical reason for that. When you are lying in bed, especially for prolonged periods, blood naturally pools in the lower legs. The calf muscles, which act as a secondary pump for your circulatory system, are inactive. When they are not contracting, blood remains stagnant in the veins. Research published in Thrombosis Research showed that adults over the age of 75 who spent more than 8 hours in bed without activating the lower legs faced a dramatically higher risk of developing deep vein thrombosis, a dangerous blood clot that can travel to the lungs and become life-threatening. Ankle pumps directly counteract this risk by engaging the calf muscles and driving blood back toward the heart. Here is how to perform them correctly and get the maximum benefit from every repetition. Lie flat on your back in bed with your legs extended. If needed, place a pillow under your knees for comfort. Slowly point your toes down toward the foot of the bed as far as they comfortably go and hold for 2 full seconds. Then pull your toes back toward your shins, again holding for 2 seconds. That is 1 pump. Complete 10 controlled pumps, then move into ankle circles by rotating your ankles slowly clockwise for 10 repetitions, followed by 10 rotations in the opposite direction. The effectiveness of this exercise depends entirely on how it is performed. Many people rush through ankle movements as if they are simply wiggling their feet. When you slow down and move through the full range deliberately, you activate not only the large calf muscles, but also the smaller stabilizing muscles surrounding the ankle joint. Research from orthopedic associations has shown that these stabilizers contribute significantly to balance during standing and are among the first muscles to weaken later in life. Perform 3 full sets of this sequence each morning before getting out of bed. Doing so helps protect both circulation and balance from the very beginning of the day. Now let's move on to number 4, where we begin building meaningful joint protection. Number 4, supine heel slides. If your knees feel stiff in the morning, ache throughout the day, or make unsettling popping or cracking sounds when you move, this exercise can be a game changer. Supine heel slides are one of the most effective ways to restore and preserve knee mobility without placing harmful stress on the joint itself. Orthopedic specialists consider them essential for anyone dealing with osteoarthritis, a condition that affects tens of millions of older adults, with the highest prevalence occurring after the age of 75. What makes this movement so effective is the position. The knee is taken through its natural range of motion, while the leg is fully supported by the bed. Gravity is not compressing the joint, and body weight is not forcing bone against bone. This allows the joint to move freely, while the surrounding muscles do the work safely. Clinical research published in the Journal of Orthopedic and Sports Physical Therapy followed adults over 70 who performed heel slides daily for 12 weeks. The participants showed marked improvements in knee function and reported significantly less discomfort during everyday tasks such as walking and climbing stairs. To perform this movement correctly, lie flat on your back with both legs extended. Slowly bend your right knee by sliding your heel along the mattress toward your body. Keep your heel in contact with the bed the entire time. Move only as far as is comfortable, without forcing the joint or pushing into sharp pain. Hold the bent position for 3 seconds, then slowly slide the leg back to the starting position. The return phase is just as important as the slide itself. As you straighten the leg, the quadriceps muscle lengthens under control, building the type of strength needed to manage real-life movements like lowering yourself into a chair or walking downstairs. Aim for 12 repetitions on each leg and complete 2 full sets. As strength improves, you can increase the challenge by reducing friction under the heel. Placing a smooth pillowcase or plastic bag beneath the foot forces your muscles to work harder to guide the motion. One detail that makes a major difference is alignment. Throughout the movement, keep your kneecap pointing straight toward the ceiling. If the knee drifts inward or outward, uneven stress is placed on the cartilage. Over time, this uneven loading accelerates joint wear. Proper alignment ensures the cartilage is nourished evenly, and the joint is strengthened in the correct movement pattern. There is another important benefit to heel slides that many people overlook. Inside your knee joint is synovial fluid, which acts as a natural lubricant and shock absorber. This fluid only circulates properly when the joint moves through its full range. When knees remain still for long periods, the fluid thickens and becomes stagnant, which is why stiffness is often worst in the morning. Performing heel slides before standing helps redistribute this fluid, warming the joint and reducing that grinding sensation many people mistakenly accept as normal aging. It is not inevitable, and it does not have to be your reality. What comes next at number 3 is where we begin addressing core strength and hip stability in a more direct way. Number 3, supine marching. This exercise may look simple, but its impact is anything but. Supine marching targets a group of muscles that many adults over 75 rarely train, which is precisely why weakness develops. This movement strengthens the hip flexors, deep core stabilizers, and lower abdominal muscles in a controlled and joint-safe manner. Why is that important? A large-scale study published in the Journal of the American Geriatric Society followed thousands of adults aged 75 and older and found that hip flexor weakness was the strongest predictor of future falls. It was even more predictive than general leg strength or standard balance tests. The hip flexors are responsible for lifting the legs during walking. When they weaken, people begin to shuffle rather than step. Shuffling reduces foot clearance, meaning the feet barely leave the ground. At that point, even a small rug or uneven surface becomes a serious tripping hazard. To perform supine marching effectively, lie on your back with your knees bent and your feet flat on the bed. Place your hands on your lower abdomen so you can feel your core engaging. This feedback is crucial and often skipped. Slowly lift your right knee toward your chest while keeping your lower back pressed firmly into the mattress. This detail determines whether the exercise works or not. If the lower back arches away from the bed, the core disengages and the hip flexors pull on the spine, which can lead to discomfort over time. Hold the lifted position for 2 seconds, then slowly lower the foot back down. Repeat on the opposite side. That completes 1 full repetition. Gradually work up to 15 repetitions per side for 2 sets. Pay close attention to the lowering phase. That controlled descent is where the deepest core activation occurs. Research from the University of Pittsburgh found that seniors who performed controlled hip flexion exercises like this for 8 weeks improved their walking speed significantly and reduced their fall risk by a substantial margin. These improvements translate directly into everyday independence, such as crossing the street safely or recovering more quickly from a stumble. Now prepare yourself for number 2, because this next exercise builds the kind of leg strength that protects long-term mobility. Number 2. Straight leg raises. If there is one muscle group orthopedic specialists consistently identify as the gatekeeper of mobility after the age of 75, it is the quadriceps. These large muscles at the front of the thighs are responsible for straightening the knee, supporting body weight during standing, and controlling movement when sitting down or descending stairs. Here is the reality many people are never told. After the age of 70, quadriceps strength declines at an average rate of 3 to 5% per year if it is not actively maintained. Clinical research published in Age and Aging found that older adults with weak quadriceps were significantly more likely to require help with basic daily activities and far more likely to need a mobility aid within just 2 years. Straight leg raises performed in bed are one of the safest and most effective ways to slow and reverse this decline without placing stress on the knee joint. This is why they are a foundational exercise in orthopedic rehabilitation programs worldwide. To perform this movement correctly, lie flat on your back with one knee bent and the foot flat on the bed for support. The opposite leg remains fully extended. Tighten the quadriceps of the straight leg by pressing the back of the knee gently into the mattress. Once the muscle is engaged, slowly lift the entire leg while keeping it completely straight, raising it until it reaches approximately a 45-degree angle or is level with the opposite knee. Hold this position at the top for 3 to 5 seconds. You should feel a deep, controlled burning sensation in the front of the thigh, which indicates the muscle is under meaningful tension. Then lower the leg slowly over at least 3 seconds. Avoid letting it drop. That controlled lowering phase is where the most significant strength gains occur. Perform 10 repetitions on each leg for 3 sets, resting about 30 seconds between sets. As strength improves over the coming weeks, you can increase the hold time at the top or add a light ankle weight, starting with as little as 1 pound. Progressive challenge is essential because muscles adapt quickly, and without progression, even effective exercises stop producing results. A 6-month trial published in the Journal of Rehabilitation Medicine found that older adults who performed progressive straight leg raises experienced dramatic increases in quadriceps strength and were far less likely to suffer fall-related injuries than those who relied on stretching routines alone. And now we arrive at the most important movement in today's ranking. Number 1. Glute bridges. There is a reason orthopedic surgeons, physical therapists, and geriatric specialists all agree on this point. If you could perform only one bed-based exercise for the rest of your life, the glute bridge would be the one. This is not simply an exercise for the hips. The glute bridge activates the entire posterior chain, including the gluteus maximus, hamstrings, spinal extensors, and deep stabilizing muscles of the spine, all in a single controlled movement. Why does this matter so much after 75? A large clinical trial published in The Lancet followed thousands of adults aged 75 and older and identified posterior chain weakness as the most significant modifiable risk factor for falls and loss of independent living. It was more predictive than flexibility, cardiovascular fitness, or even overall leg strength. When these muscles weaken, the pelvis tilts forward, spinal alignment deteriorates, balance shifts, and posture collapses. The forward-hunched posture commonly seen in older adults is not just cosmetic. It directly disrupts the body's center of gravity and dramatically increases fall risk. What makes this more concerning is how quickly the gluteal muscles weaken with inactivity. Research has shown that adults over 75 spend the majority of their day seated or reclined, during which the glutes are largely inactive. Over time, the brain loses efficiency in recruiting these muscles, a phenomenon sometimes described as gluteal inhibition. The glute bridge is one of the most effective ways to reverse this pattern and restore proper muscle activation, even after years of inactivity. To perform the exercise correctly, lie on your back with your knees bent and feet flat on the bed, positioned about hip width apart. Your heels should be close enough that you can almost touch them with your fingertips. Before lifting your hips, squeeze your glute muscles firmly. This pre-activation step is essential. Without it, the hamstrings and lower back tend to dominate the movement. Once engaged, press through your heels and lift your hips toward the ceiling until your body forms a straight line from shoulders to knees. Hold this position for 5 seconds while maintaining the glute squeeze and breathing normally. Then lower your hips slowly over 4 seconds. Just before touching the bed, drive back up into the next repetition without resting at the bottom. This continuous tension approach has been shown to significantly increase glute activation compared to pausing between repetitions. Begin with 10 repetitions for 3 sets, resting about 45 seconds between sets. As strength improves, progress by performing single-leg bridges or by placing a pillow between your knees and gently squeezing it to engage additional stabilizing muscles. The outcomes from consistent glute bridge practice are substantial. Participants in long-term studies who performed this exercise regularly experienced major reductions in fall risk, improved walking endurance, and a significantly lower likelihood of transitioning from independent living to assisted care. These are not small changes. They represent the difference between maintaining control over your daily life and losing that independence. To summarize, these 5 bed-based exercises are far more impactful than stretching alone for adults over 75. Stretching improves flexibility, but it does not build the strength, stability, or joint protection required to remain mobile and independent. Ankle pumps, heel slides, supine marching, straight leg raises, and glute bridges collectively address circulation, joint health, core stability, and the powerful posterior chain muscles that keep you upright and moving confidently. The entire routine takes less than 15 minutes, requires no equipment, and can be performed on any mattress. You do not need a gym, expensive machines, or painful workouts. What you need is consistency and targeted functional strength. Start with the movements that feel manageable. Perform them every morning before getting out of bed and gradually increase repetitions and intensity over time. Even 5 repetitions on the first day is enough to begin the process. What matters most is that you start and continue. Within a few weeks, getting out of bed will feel easier. Walking will feel steadier. Everyday activities will require less effort. Your future self will thank you for every repetition you complete. If you found this information valuable, consider subscribing so you never miss important health content like this. Thank you for watching.